Very warm welcome to the programme. Thanks for joining us. Look, we wanted to talk to you because, of course, press conference yesterday evening, the Prime Minister saying no further restrictions, and yet he said we can expect the health service to be overwhelmed and 1.2 million people sitting at home isolating for various reasons. Is this the right decision?
Well, yes. I mean, obviously, we acted very, very quickly once we first learnt of Omicron. We closed the borders, and then obviously we introduced Plan B, which includes people working from home, obviously lateral flow tests before you go to large venues, etc., and wearing masks in many more places. So we've introduced those measures, but the most important measure that we've introduced is really bringing forward our booster programme, because the most important thing now we can do is we bought enough time for people to get those boosters, and we did meet the target for the end of December, but we still have more people to get to through the booster programme. So 2 million slots this week. If you haven't had your slot yet, come forward, please. This is the week to get vaccinated, because it makes a massive difference to our hospitals, to the hospitalisation, and also to how severe the illness is.
What sort of difference will it make to the curve, to the wave, Minister? Where are we on that curve at this moment as you speak?
Well, obviously what we know is it does protect you against infection by about 70% and against hospitalisation by about 88%. And one of the things the Prime Minister told us yesterday is that if you look at the serious illness, severe illness in ICU, 61% of those people have not had any vaccines and 90% have not had their booster. The booster is a really important step to building back up that wall of defence. So it does make a big difference. So the more people can come forward, and it takes a week or two before you feel the benefits of it. So please, today is the day you should come forward if you haven't had your booster.
Before Christmas, you refused to rule out a circuit breaker. Does this mean you're now definitely ruling it out?
Well, what we've been doing all over Christmas, every day, 3 times a day, we've been meeting, we've been looking at all of the various aspects of the data, and, you know, we act on that, really. So getting the booster is the most important thing. Obviously, the working from home is a big part of minimising, particularly now people are back at school as well, as minimising the amount of people out and about. But the most important thing is the booster. And when we look at the impact of any future or further measures, the most impactful is getting people boosted, and the ones that we have in place today is Plan B.
You don't have to look far in the papers today to see the impact that Omicron is having on the health service. There are people being told if you're having a heart attack, get a taxi or get someone else to drive you in, because there simply aren't the drivers. Many hospitals having to cancel routine operations, and yet the Prime Minister is saying carry on as is. Is that not just simply because he's lost the political capital? He doesn't have the support of his own party, and quite frankly, there are big question marks about whether or not he can continue to lead the Conservatives.
No, not at all. We've been looking at the contingency plans and building up the contingency plans all over the Christmas with our colleagues in the NHS and the people working in the NHS trusts. So the critical state that some of the trusts have declared, that is the first stage actually in our contingency planning, and it's a local decision that trusts can make to call on to say they need some additional support, whether that's mutual aid from their NHS colleagues around, or
in hospitals. That can't be part of a routine plan. That's not going to be good news for anyone.
It's part of a contingency planning arrangement that we have in place for winter planning. We always have these plans in place. We always have the plans to also consider curtailing or slowing down electives. These are part of the usual winter plans that we have in place. Obviously, we've got much more pressure this year with Omicron. But yes, we do always have winter plans that have these step-down arrangements. And what we've asked is for the plans to be based on 10, 20 and 25% absentee levels, so that we can work out what we would do in each of those scenarios. So yes, these are the sort of plans that actually the local resilience forums have had in place all the way through the pandemic.
Minister, we're hearing about the critical state with the National Health Service. I'm a wee bit worried, though, and this is one of your responsibilities, the care system in general. I'm sort of fearing that what we hear with the NHS has to be replicated in the social care system. In other words, it's going to be hit hard with staff shortages.
Yes, and actually not just the health and care sector, but many other sectors as well, which is why the Prime Minister announced yesterday for some other critical workers to have the daily lateral flow tests capability. But of course, and our health and social care staff are working incredibly hard, doing an amazing job, as they have done for the past 2 years, but they are under intense pressure right now. There is absolutely no doubt about that. And we're hoping that it's not going to be for a long time, obviously, but it is a lot of pressure as we have, absentee rates of 10% more or less. It does differ across the country, but that would be the average. And of course, that does make a difference, which is why, of course, we also looked at whether we could reduce the isolation period. We reduce that from 10 days to 7. If you have a negative test on day 6 and day 7, then you can leave isolation sooner. And obviously, some of those staff members will be coming back all the time, every day, as well as they are released from isolation.
And just tell us, can you confirm these changes that are being reported in some of the papers about the start date of your isolation? So if you can scrap the PCR test, you can start your isolation from a positive lateral flow, which could mean people get back to work sooner.
Yes, you can start today your isolation from when you first have symptoms, or when you first receive a positive lateral flow test or a confirmatory PCR test as well. So that's the system today. If you have symptoms, you start your isolation from them. But the most important thing is you need 2 negative lateral flow tests on day 6 and day 7.
Gillian Keegan, Minister in the Department of Health and Social Care, good to talk to you this morning. Thanks for taking the time.
Thank you.